Good evening. I am Dr. Odomo Eshemoha. I am a resident doctor in surgery. I I have seen many videos where different nationalities talk about residency training program in their countries, but I noticed that there's no video that really try to educate the public about residency training in Nigeria. So that's the reason I'm doing that. So this video is going to be long. It can be up to an hour. It can be up to 30 minutes because I'll just talk about these things, this issue of medical residency in Nigeria as it comes to my mind. As it comes to my mind. I'm a surgical resident, so I'm going to start from there. You see, residency training program is a program designed, it's a postgraduate program designed for medical doctors, people that have their MBBS degree, their first degree in medicine. It is designed for them and for those people, for those doctors that want to be specialists. In Nigeria, we call them consultants. Yes, we call them consultants. In other countries, they call them consultants too. Most times they call them specialists. Yes, that's what they call them. All these professors of medicine you see today, they went through residency training program, and um, the steps in becoming a resident is what I want to attematize. Now, first, you need to be a doctor. You need to be a doctor in any field. You need to be a doctor in any field. That is MBBS. You must have it. 6 years program. After that, you will do internship, the one we call house job or housemanship. You will do housemanship. After you have done housemanship, if you are still eligible for the National Youth Service Corps, you will go for your NYC, where you become a corporate doctor. After you have done your NYC, you will do primaries. Yes, this is where you will now determine where you want to specialize. If you want to specialize in surgery, you will do primaries in surgery. There are two faculties eh, for surgery. You have the National Postgraduate College and the West Africa College of Surgeons. Yes, so these are the two exams you will write. You can decide to write one. You can write the national, you can write the West Africa, or you can write both, depending on what you want. Now, that's for people that want to be surgeons. For that orthopedic surgeons, they have their own special faculty now, where you will write primaries in orthopedics. There's a special exam they write primaries in orthopedics. For ear, nose, and throat surgeons, ear, nose, and throat surgeons, they also have their own faculty where they write their own exams for surgery. Now, there are other surgical departments like the obstetric and gynecology. They have their own college too, their own faculty that conduct exams for them, which will be national or West Africa. These persons, these candidates for that want to be specialists in, that want to be gynecologists and obstetricians, they will also write these primaries. Exactly. Yes. Now, after that, you are expected to pass. After you have passed the exam, you will now when any of these teaching hospitals, yes, you can do residency in this particular in this kind of hospitals, federal teaching hospitals, state teaching hospitals, federal medical centers. Yes, there are federal medical centers in almost all the states in the federation. There are some specialized hospitals like run by the states, like the general hospitals. Yes, in general hospitals like the one in Central Hospital, the one they now call those specialist hospital. They allow residency training program in family medicine and even O&G, but not in surgery now. They don't have the facilities to train surgeons. It's small, small. Now, um, there are also special centers. So there are some private hospitals where you can do residency, like the Lily Hospital, the one in Warri and Benin. They have programs for residency training in O&G and family medicine. There's a hospital in Enugu, I think Enugu, called Memphis Hospital. General, they take resident doctors that are interested in neurosurgery. Yes, they take slots. They accept them for residency training in their part 2. They take them. So the list is on and on. But in summary, what you need to know is that if you want to go do residency, you can do it in federal medical centers. You can do if they are accredited for the program you want to go for. You can also do it in teaching hospitals, whether state or federal, some private hospitals, and even some general hospitals that allow family medicine and O&G. Now, residency program is not beans. It is rigorous. It is stressful. It requires both physical and mental strength to scale through. It is not easy to become a consultant anywhere in the world, and the program is stressful. It's quite stressful. But if you are dedicated and you know what you want and you know your intention is to become a consultant in whatever field, I think you can scale through. It's not something that has not been done before. Recently, about 5 of my senior registrars became consultants. It was not easy for them, but they are consultants today and they are happy with themselves. So for after you have done all this, these hospitals that offer slots for residency training will call for employment. You will apply. When you apply, you go for the interview. If you pass the interview, boom, you're already a resident doctor. You are going to start. Now, when you start, it depends on the faculty, your choice of specialty. For surgeons, especially for West Africa, is after you have done 36 months of posting, you'll be posted from one department to the other. Like me now, a resident doctor, I've done 9 months in general surgery. I've done 6 months in plastic surgery. I've done 3 months in orthopedics. Yes, training. I will do 3 months in anesthesia. I will do rural posting. Then I will do posting in trauma. Yes, accident and emergency medicine. I will also do posting there. It is after I've done all these postings and I've done 36 completed months of posting, I will now be eligible to go for part 1. Yes, I'll be eligible to go for part 1. After I pass if I succeed in passing my part 1, now the next thing I will do, I'll become a senior registrar. Then when I become a senior registrar, after then I'll start my dissertation, doing my presentation, doing my research. Then after 3 years, yes, 3 years, I'll go for part 2. If I pass my part 2, I'll become a consultant. I don't want to use the word as easy as that. If it's national, I have primaries in national. It will not take that long. I'm expected to go for exam in 24 months or so, in 24 to 30 months when I come, because the posting in national is not as prolonged as that of West Africa. I'll go for exams after my 24 completed months of posting because I will not do rural posting in national. Now, if you have only West Africa and you don't have national, you can take exemption. Yeah, you can pay for exemption. You'll be exempted from writing national. After you have been granted that exemption, you can now write both exams in part 1. You can write both exams in part 1. During this residency training program, it's rigorous. It involves academics, physical strength, mental strength. You will be taught clinical. You'll be taught the academic aspect of clinical medicine. You'll be taught the proper clinical medicine where you have hands-on. You'll also be taught skills, how to operate on patients. You assist surgeons that is for residents in surgery. You assist in surgery. You will be the one working on patient for surgery. Yes, you work on patient for surgery. You take patient to make sure that patient is fit for surgery. Then when you also learn clerkship, how to present topics, You learn principles of surgery, principles generally of patient care. You will learn a lot of things. You also learn how to use instruments. It's an open air where you can do a lot of things if you are interested. Now, that is that for residency training in surgery. If there's any other thing I need to say for residency training in surgery, I will let you know. For internal medicine, what we call physicians, they have a body called the National Postgraduate College of Physicians or the West African Postgraduate College of Physicians, irrespective of the one you want or anyone you want, or as your pocket directs you, because you need to pay for these primaries. You go and write the primaries. If you pass, you go through the same process and become a resident doctor. When you become a resident doctor, the duration is not as long as that of surgery. Within 24 to 30 months, most times they go for part one. They go part one is a form of exam. Oh. Yes, they go for part one. After they go for part one, and if they pass, they become senior registrars. And from there, they become later, they do their dissertation, run clinic, run their do presentation, and after that, they become consultants too. That's very straightforward. Truly, it's not as straightforward as I'm saying it. So it's complex. It's rigorous. You have a lot of sleepless nights. Now, there's also residency training in radiology. Yes, those people that use X-rays and machines, ultrasound to take pictures of the body tissues to help arrive at a diagnosis. They are diagnostic physicians. They also do primaries in West Africa or national, do residency, then start residency, and after some time they go for part one, later part two, and they become consultant in radiology. That's that. Then for the O&G, O&G is always very populated. I don't know why. I remember when we were going for interview where we were about let's say we were about 50 or surgeons. O&G were over 300 that came for interview. Yes, they were over 300. I don't know. I think it's a booming market for them. The you either write West Africa or national primaries in O&G. When you have passed, then you start your residency program. From there, you climb through the ladder and you become a consultant. There's also residency training program in family medicine. There's residency training program in ear, nose, and throat. It's all the same process. You write primary. You cannot start um, residency training without primaries. Even in this era of Jackpot syndrome, where candidates, doctors are now taken as MO, are now taken into residency training program before, so that because there's shortage of staff. Yes, it happens. Even in this era, after some time, the hospital will request that you go and write primaries, or you bring your. In fact, part of the agreement is that within 1 year or for the first 18 months, you will have provided your primaries. You can be taken without primaries. Yes, many hospitals do it now. Yes, it is the times. People are leaving the country. Doctors are leaving the country because they feel that they are not well paid. Yes. So people, you can be taken without primary, but within first 1 year, you'll be told to provide your primary. There's also residency training program in pediatrics. I don't want to leave any specialty behind. I just remember that one now. Yes, pediatricians. Yes, there's residency training program. It's still the same process. You write primaries, you go for part one, then part two, you become a consultant. There's residency program, training program in um, mental health. Yes, psychiatrists. They have resident doctors. You go for primary school to gain entrance into the system. There's family medicine. Yes, family physicians. They have their primaries, they write their primaries too. They start residency. I've had so many encounters with family physicians. They can do a lot of things, and they are very good. Their clinical acumen can be very good. They do that same program too. After they've done the program, they do after they've written their primary, they start residency. They are posted from one unit to the other. After they've completed their number of months before they can write their part one, they go for part one. And if they pass, they become senior registrar. After the senior registrar level, they become consultant. Now, the resident doctors are not, let's go to the pay. To pay. Or before I talk about the pay, the salaries of a resident doctor, it's important I tell you about the duration. I talk about the duration of residency training program in Nigeria. For the duration, I think within 6 years of residency training program, you should become a consultant. Within 6 years, you should become a consultant. Within 6 to 7 years, if you don't have any, how if you don't have to write an exam twice, yes, you should become a consultant. If you are patient enough, within 5, 6 years, you become a consultant. And radiology is quite shorter. Even internal medicine is quite shorter. But for surgery, I'm talking about surgery now, within 6 years. This thing na eye for the tail. Within 6 years, you'll be done and dusted with your residency training program. And you start bearing the tag of a consultant. Yes. Now, let me talk about the salaries of a resident doctor. Resident doctors are not really the salaries of a resident doctor. I'm not the one that complains. It's not really that good. Yes, it's not really that good, but it's not bad as portrayed. It's not as bad as portrayed. But because of the economic realities now, the salary has become quite too small. For a registrar, a junior registrar, you have a junior registrar, you have a senior registrar. A junior registrar is that registrar that have not passed part one or yet to pass part one. A senior registrar is a registrar that has passed part one and now is now preparing for part two exam. After passing that part two exam, he becomes a consultant. Constitutionally, a junior registrar earns between 350 to let's say 450K a month. But most of this salary, the high side, the high mark, I said 450K, get that more in the north. It's commoner in the north. Well, down south, resident doctors barely earns 350. Well, maybe with this new minimum wage they want to add and the rest, maybe it will jack up the salary. But that does not still mean that it's still commensurate to what uh, the counterparts of uh, an average resident doctor earns abroad. But it's not that resident doctors are super paid abroad though, but it's still better than what is gotten here in Nigeria. Or senior registrar, their salary is better. They earn close to 500 to 600,000 naira per month. That's what they earn. They earn close to 500 to 600,000 naira per month. The senior registrars are specialists in their area. It's just a matter of time for them to become consultants. Yes, the challenges. I want to exhaust this whole topic. There are challenges of residency training in Nigeria. Challenges are not far-fetched. One of the challenges, I want to group it into personal challenges, uh, family challenge, or okay, personal slash family challenge, then hospital place challenge. For personal challenge, resident doctors, they hardly rest. They are called resident doctor because they are expected to stay within the hospital. They reside within the hospital. And like you are not expected to live beyond 3 kilometers from the hospital. You are expected to be readily available. You are expected to take your calls and the rest. Now, because of that, you don't have time for any other thing. Forget that I'm doing this video. I try to create time anyway. I try to create time because I must do other things. They don't really have time for themselves or their families. That's one of the personal challenge. When you start this residency training program, it's like a never ending cycle. You keep on pursuing it and pursuing it and pursuing it until you get it. Anything that makes you turn your eye away, you may lose it. So personal challenges, you don't have time for any other thing. You just keep on This residency training program is like what you were born to do. It's a big challenge. You have family issues. Sometimes you end up having spouses, wives, husbands that don't understand the nature of your job or the nature of your training. They start asking questions. There have been issues of divorce because you are never at home. Sometimes I know a resident doctor that said that he didn't even know when his son started talking or walking because he has spent 6 months in the hospital. He didn't even know. He said his father. I know a lady that said his children barely know her. She's a resident doctor. So those are some of the personal challenges. Now, finances. In terms of finances, the money is not enough. You are working so hard and you're not getting so much money. Yes, it's a challenge that can be discouraging. But don't worry. As for the finances, the money will come as you become a consultant. And that I assure you, if you apply yourself, you make so much money. As far as this Nigeria is concerned, you make so much money as soon as you become a consultant. I assure you. Now, hospital challenges now. The program is well organized. Well, for where I'm training, the program is well. I don't know about other centers, but my program is well organized. The teaching is top notch. The training, the hands-on is top notch. I have access to my consultants. I have access to my senior registrars. Yes, it's top notch. I'm not here to come and start bashing. If you are here to hear me start bashing, no, 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 no. There are challenges which I've mentioned, but I will also say the good part. Now I have access to my consultants, quite all right. Yes. The training is not bad, but sometimes there are some challenges in the workplace. You may end up having trainers that are not very cooperative with you, that don't like you, just like every workplace issue. Also, facilities for training. Facilities for training. Most centers don't have the standard facilities to really train you. Yes, most centers don't. That's why there's accreditation every year. When this accreditation team comes, they look at your facilities and if they notice that your facilities are not up to date or are not adequate, they withdraw your facility, your accreditation for that specialty. So we have full accreditation where I train. Full accreditation we have where I'm training. We have full accreditation. So that means the facilities are at least average. Facilities are at least average. Now, other challenges you may have is the duration. The senior training program is takes too quite it's quite too long. It's quite too long and it can be discouraging. In fact, it's discouraging for some people when you look at the duration of time and say, hey, let me just run to UK and go and start making money. Or even in UK, there's residency training there. If you run to Canada, except you want to be um, a, just a medical officer, if you want to specialize, you must go through residency. There's no country in the world that does not have programs for residency training where specialists are being churned out, well trained specialists. Is there any other thing I'd like to talk about residency? Um, yeah, I've talked about the salaries, I've talked about the nitty gritty. I don't know if I missed any department. Yes, I missed. There's residency training program in dental surgery. Dental surgery, yes. Maxillofacial surgeons, dental surgeons, pediatric community dentistry. Yes, there's residency training program for that specialty, and we have them in my center. It's still the same. You write primary, you go to dental school, medical school. Most times they are with medical student, dental student, and they are the same people. You go to 6 years of medical school, then you do your internship, house job in dentistry. After that, you go for NYC if you are still eligible. Then from there, you become, um, you write primaries and become a resident in dental surgery. Yes. Community medicine, community health, there's also program. They also have programs for residency training. Yes, I am trying not to forget anything or forget any specialty. Orthopedics too, I've mentioned this. There's a residency. In fact, they have their own big faculty. They have their own big faculty. If you want to be a plastic surgeon, a cosmetic surgeon, there is a residency training program for that. Yes, where you will be trained to become a cosmetic surgeon. Yes, cardiothoracic surgery. Yes, cardiothoracic surgery, urology, in surgery now. There's urology, neurosurgery, general surgery, pediatric surgery, um, orthopedic surgery, plastic surgery, ear, nose, and throat surgeons, head and neck surgeons, dental surgeons, O&G, family medicine, radiology, pediatricians. These are all programs. They all have programs for residency training. They all have programs for residency training. Um, Even nuclear medicine, yeah, under radiology. Oncology. Oh, I nearly forgot oncology. Yeah, those doctors that treat cancers. There's a residency training program for them. Yes, I've talked about the requirement for residency training. I have talked about the how to become a resident doctor, your aim of becoming a resident doctor, which is to become a specialist, the salaries, the challenges. What have I not talked about? The different specialties. I've also talked about the different specialties of um, residency. I've talked about the hospitals, the teaching hospitals, federal medical centers, and what have you, that you can do residency training program, including private hospitals. Yes, I've talked about that. Is there anything that is left out that I've not talked about? One thing is this: if you are doing residency training program, let's say in Lagos, in Lute, and you are because of marriage or you are tired of staying in Lagos, you want to move somewhere else, you can transfer your residency training program to another teaching hospital or even federal medical center. You can transfer from Lute to National Hospital. You can do that and continue your program. It's allowed. And there are some special benefits in residency training program, like the medical residency training fund. There is a yearly amount of money you are giving. Federal government pays you every year. They also encourage you because you spend a lot of money writing exams. You just say, well, federal government reimburses you, and this reimbursement is constitutional. It's not misappropriation. Yeah, there are some benefits in becoming a resident. There are challenges. If you are interested in becoming, as far as you are still in Nigeria as a doctor, I always advise the young ones, of course, I'm a young person, I always advise the young ones that are still around, that are still around, irrespective of your plans, Jackpot plans or whatever. I don't encourage Jackpot. I don't encourage you. You do what you want. I don't like talking about it anyway. Anything you feel like doing, do it. As far as you're in Nigeria and you're a doctor, try as much as possible to become a resident doctor. Try as much as possible to become a specialist. And you can only become a specialist through residency. Any other, I don't know. If there's anything I didn't talk about, any specialty that I didn't talk about in this video, please pardon me. I am not looking down on your specialty. Yes, there's this program, residency program that just started now, emergency medicine. They have resident doctors. They even have consultants. They just started. It's no more than 2 years old now in some centers. That is good news anyway, because we need specialists in emergency medicine. It's also there. So I'm mentioning it now. So that you will not fight me in the comment section. There are some programs that others. Oh, I did not mention ophthalmology. Yes, ophthalmology is either from optometrists and obstetricians. Sorry, I said opticians. An ophthalmologist is a consultant in in eye. That is the eye surgeons. They are surgeons in eye care. Surgeons. I nearly missed that out. Okay, okay. I think I've mentioned. Why will I nearly miss ophthalmology? That's not fair. They also do primaries. Ophthalmologists, they do primaries. From primaries, they first you must be a doctor first, not an optician, not an optometrist, a medical doctor. After that, you can now go and specialize. You write primaries in ophthalmology. When you pass, you start your residency training program. You can become a consultant, West Africa consultant, a national consultant, anyone you want, irrespective of the faculties. You can choose any of the faculties, or you can write both faculties. It's allowed. I don't know whether I've missed out anything again, but I think I dealt exhaustively with this topic. At least let's still have um, let's still have a footprint of residency training program in Nigeria, medical residency training program in Nigeria. Ah, it's important now. Nigeria is the giant of Africa. Other countries cannot be writing their own, talking about their own. We are not talking about. Sometimes we don't always. You don't always. It's not every time you dwell in negativity. Nigeria produce great consultants that are still in this country. Some are doing well abroad. They all started their residency here. They became consultants, specialists here. Did their residency training program here. Yes. I'm just trying to see delay. Yes, I've mentioned pediatricians. Yes, ONG. Yes. Up to know there is also politics within residency training program where you do your yearly program, your yearly politics where you can become yes, there's an umbrella body of resident doctors called Association of Resident Doctors. When it's national, it's called National Association of Resident Doctors. Sometimes you hear they go on strike because they are demanding something from government or they want better pay, they want better condition of service. Yes. And of course, you know that to fill up these spaces, this leadership, this association will have leadership position. And the only way to fill up this way is not by appointment, it's through elections at both the local and the national level. Yes. Any other thing I've not discussed in residency training program. After you have become a consultant as a resident doctor, yes, your hospital can retain you or they may not retain you. Anyone. You can decide to go and offer your services, your, your services in other hospitals or even outside the shores of this country. Good luck. I think I've talked about everything in this video. I really talked about everything. If there's any other thing I didn't talk about, please indicate it in the comment section. I want to upload this video now. You can subscribe to my YouTube channel. I'm a medical doctor. My name is Dr. Udomo. Subscribe to this my YouTube channel. I'm on TikTok too. I am on Facebook. Yes, I'm on Twitter. Yes, I want to also have a medical community where we can vibe and talk. Yes. Next video I'm going to talk about the salaries of a doctor, how much a consultant is paid in Nigeria. Bye bye. I think I'll leave you here now.